Thank you. It's a proud honor to introduce Dr. Morley to you and welcome all of you here in Kirksville as well as those of you in Arizona to our second lecture on aging as part of the geriatric initiative across the university. So welcome all of you, students, friends, alumni, etc. In particular, welcome Dr. Morley. Dr. Morley is the Dammert Professor. Let me spell that. D-A-M-M-E-R-T. So he's the Dammert Professor of Gerontology at St. Louis University Medical School, and is also Director of the Geriatric Research, Education, and Clinical Center at the St. Louis VA Medical Center. Dr. Morley was educated at the University of Witwatersrand in South Africa, his native country. He received postgraduate training at UCLA and is board certified in endocrinology and geriatrics. Dr. Morley is the author of a number of papers and 14 books. Let me just read a few of the titles. Geriatrics, Nutrition, second edition, Memory, Function, and Aging, and Related Disorders, Medical Care in the Nursing Home, Frailty in Older Individuals, As We Age. In 1990, he was included among the 100 most cited scientists in the world. Dr. Morley's current research topics include memory, function, nutrition, and endocrinology in the elderly. It gives me great pleasure to present to you Dr. John Morley.
Thank you very much. It's great to be back here. I think I was last here about 8 to 10 years ago. Since then, a number of my junior faculty have been up here, but it's always a pleasure to drive all the way up to Kirksville. And the interesting thing is when my daughter was in Macon, nobody ever invited me to come up here, where I had a really good reason to come up. But now that I had no reason, I'm back here, so it's wonderful to be back. And it's always great. I was actually in Atlantic City earlier this week for your national conference. So this is my osteopathic week, I guess I should say, I'm seeing both sides, the senior osteopaths this week, and now I'm seeing the students, which is wonderful, because the students are always far more fun, let me tell you. Sorry about that for the faculty. So I'm going to talk a little bit about aging successfully and some of the fun things that are going on in the field of aging, and I hope you'll enjoy this as much as I will. So the first thing I've got to point out to you, because many of you are so young, I mean, you know, you're young enough to be my kids' kids almost, so it's very frightening. So you may not quite have worked out yet that we're an aging population. And back here in ancient Rome, the average population age was 22. That didn't mean that somebody like Cicero could live to 80, but on the whole, people died off real young, and most of you would have been dead by now, so we wouldn't have had to worry about you. But now we've got to educate you because, you know, you're still around, so that's the starting point. So, by the time we got to the beginning of the 20th century, that was roughly 106 years ago, back in that time, the average American didn't quite make it to 50 years of age. So again, geriatrics was not a big deal back then. But now we're doing much better. We've moved forward, and by the turn of the 21st century, the average American was basically making it, if they were female, to 80. If they were male, they were making it to around 77. Us guys always die off earlier than the women. I'll come back to that later and point out to you it's not totally bad, okay? And we'll see. And my wife always tells me, by the way, that the reason this is very straightforward. The women keep us alive, and that's why they have to live longer than us, because otherwise we'd be in trouble. But, you know, this is life. Now, the point we've got to get out of this is, however, despite the fact that we spend 16% of our GNP on healthcare, more than anywhere else in the world, we are never number one in longevity. Number one in longevity is mostly Japan. Some other small places like Macau and Hong Kong can in some years be number one. But these are usually island places. They live much longer than us, 3 to 6 years longer on the whole, and do much better. Now, part of this is they're islands, and island places eat a lot of fish. Fish is good for you because it has in it these fish oils called icosapentaenoic, docosahexaenoic acid. You don't have to remember the name, but they stop the platelets clumping together. And you know that many of us die in the United States because our platelets clump together. We have heart attacks and strokes and die. So eating fish is good, and most of the studies show that if you eat fish at least 4 times a week, you'll do very well and live a long time. Now, we live in the Midwest. I once had to give a talk like this in Nebraska. I said, you've got to eat fish 4 times a week. It was at a school that was funded by the beef people. Got me into all sorts of trouble. Okay, so you've got to watch out what you say. I do want to point out, however, that in the United States, in most healthcare measures, we come in, last year 27. It varies between 25 and 35. That's terrible. We do as well as Cuba, so that's pretty good. I mean, as long as you think Cuba does great healthcare, and Cuba is a place to be emulated, we're doing very well. And some of this is because Cuba has no money, thanks to the United States and the Cubans in Florida who don't want them to have any money, and therefore they spend a lot of time with high-touch medicine. Medicine's divided into high technology. We do that wonderfully in this country. However, we tend to spend all the money on high technology, not high touch. One of the things I love about osteopathy is that you are at least theoretically a high-touch field. Now notice I said theoretically, because I'm looking at the students out here, and I know that at least half of you are here because you really wanted to go to medical school and you finished up coming to an osteopathic school because that's what you got into, and you basically are not going to learn any of your osteopathy. How do I know this? Because I've recruited a lot of students from Kirksville over the years to come into our program. You guys are great. You have really great clinical skills. You come out of here with some of the best clinical skills I've ever seen. But everybody I've recruited, I do a lot of manipulation in my clinics with older people. I treat headaches with manipulation. I treat low back pain. And I want to have a clinic, a manipulation clinic for older people. So I recruit osteopaths to come into my program so I can have a manipulation clinic. As of yet, I have not found a single osteopath I've recruited who could do manipulation. I knew more than they did when they arrived. This is frightening. So please, as you go through medical school, make sure you can manipulate. It makes such a big difference to people. You can make a huge difference. So please learn that, and then come and work for me so I don't have to do all the hard work anymore. It would be wonderful. The lady up there is Jeanne Calment. Madame Calment was the world's oldest woman. She lived to 122 years of age. Now, she smoked until she was over 100. This tells you that genes are very important. And if you've got great genes, you can smoke. Unfortunately, most of you don't know that you've got great genes, so you shouldn't be smoking. Okay, so let's stop smoking right away. It's the single worst thing you can do for your health. She also rode her bicycle till she was 106. That is good. Exercise is wonderful to keep you going, so remember that. Now, she had a number of other claims to fame. One is she met the painter, Van Gogh, when she was a young girl and he was slightly old, and she said that he was a dirty old man. Now, none of us would have cared that he was a dirty old man, except she lived to 122, and so she told everybody when she was about 116 that he was like that. She actually recorded a rap song when she was 120 that became one of the top hits in Europe, okay? And in addition to this, she kept her memory till the end. I'm a very good friend of the psychologist who used to see her every year. And this woman told me that she had 4 children, and every year Madame Calment would ask by name and could remember what had happened the year before and asked how they changed, what was going on. Now, I know that this is a phenomenal memory because I've known this young woman who's about younger than me, about 10 years younger than me, for about 25 years. I now know she has 4 children, only because I remembered it because she told me about Madame Calment. Up till that time, I never remembered that she had 4 children. I have no idea of the names of any of her kids, okay? And I see her at least 5 times a year. Pretty awful, you know. So Madame Calment did really well. The final thing about Madame Calment is she was a great business person. Because in France, when you reach 80, you can sell your house or apartment, and you can live in it till you die. Wonderful thought. She sold her apartment to a 56-year-old lawyer. I'm happy to report that the lawyer died way before she did. Okay, so one of the things that has changed, not only are we living longer, but we also live longer as we get older. And this is important as we go into medicine and look at looking after people. Because if you look here, and let's just take an 85-year-old woman, 85 who's healthy, can expect to live another 9.6 years. This means that this is equivalent to about a 60-year-old when I went into medical school. So when I went to medical school, there were lots of people, they said, well, you know, if the person's 80, don't treat them. You're not going to make a difference. And certainly you're not going to fix an aortic aneurysm that may burst in 5 years' time because they're only going to live 2 and there's a chance you'll kill them. That's changed dramatically. And you have to look at whether people are healthy, average, or frail. But look here, if I'm an 80-year-old woman and I'm frail, I'm still going to live another 5 years almost. That's a long time. So we have to learn to be much more aggressive than we used to be with older people. So when I started out medicine, old people were 60. I will be 60 this year. I'm not old, okay? No matter what you may believe, I don't feel I'm old. I'm not close to being old. But in my day, most people age 60 were old. They had worked really hard all their life at physical labor. They were worn out when I saw them at 60. This isn't the case anymore, so the world is changing. The world as a whole is aging. It's not just the United States and the developed world. Back in 1950, 46 years was the time of dying, 66 years by 1998. 1998 was the year before the year of the aging, and Kofi Annan, the Secretary General at UN, said life is becoming less like a sprint and more like a marathon. How many of you in the audience basically run marathons? Oh, not many, gee. Well, that's good, by the way. I'll tell all of you that the people who put up their hands, my granddaughter says I should never use this word, are stupid. Okay? Because you're going to wipe yourself out. Running 10Ks is nice. Running marathons is most probably too far. You will eventually hurt yourself, and you may not do as well as you think you will do. But for those of us who've run marathons in our life, what you know is that you get to about the 20-mile mark, and suddenly you feel like you can't go on. But if you've trained well and you've done your nutrition right and everything right, somewhere around about 24 miles, you suddenly find that you feel wonderful. And that last couple of miles is really the best part of running a marathon. And that's exactly what's happening with aging. And if you don't feel that way, I don't know why you're running a marathon. Okay. So let's get this right. Okay, so basically, this is what's happened with aging. Aging now is, if you do the right things, by the time you get to 70, you're starting to have aches and pains. Things are going to go wrong. This is life. You are doing the right sort of exercise. You're keeping your body weight stable. You're doing all the right things. You're getting adequate, appropriate treatment. Somewhere around 75, 80, you suddenly feel very happy. And I've seen this with many patients. If the things go right, they do very well. It is just like running a marathon. So think about that as we go through this. And this is just showing you again the world aging and making the point that the place that isn't aging anymore is Africa. When I left South Africa, the mean lifespan was 67. That was 30 years ago. And now it's down to 43. This is the AIDS epidemic. As you go into the middle of Africa, malaria and other things. And there, geriatrics is not a problem. Africa needs help with young children, and hopefully some of you will be going out into the world, and you will be helping to improve the health care of people in Africa. They desperate needs in Africa. Basically, it's 105 days of the war in Iraq would solve all the healthcare problems in Africa, if you just want to know how much money we're spending on the war, okay? Not saying we shouldn't be spending on the civil disturbance or whatever it is, but just understand it. So what is happening now? What is exciting that's happened? This is Italy. Italy has the largest population over the age of 60 in the world. You know, that's where the Vatican and the Pope are. And they have the largest population over the age of 60. You've got to think about why this is. They don't live the longest, but they do have the highest use of contraception in the world. So Vatican contraception, high. Makes sense. I understand this. You've got to always think about the conundrums we live in this world. And this is the aging pyramid in Italy now. Used to be that the pyramids were like this. They were a pyramid, okay? And lots of young people, not very many old people. As time's gone on, it's sort of rectangularized. But Italy has managed to turn itself upside down. So the pyramid is now like this. Here are the kids, virtually none of them, about 1.2 kids per family. Here's the family, here are the middle-aged, and there's going to be nobody left when these boomers get to be old to look after them. So you've got to continue to have children. China is going to have huge problems because of the huge population and the one-child problem. So we need to pay attention to this. So what about geriatrics? This is a quote from George Edward Day. He wrote this in 1848, and he said, "I offer no apology for the publication of this volume. The subject is one of the highest importance, and yet it has been strangely overlooked during the last half-century by physicians of all countries." Why am I showing you this? It's an 1848 quote. Because I just published, along with Alan Sinclair and John Pathy, the major European textbook of geriatric, Pathy's textbook of geriatrics. The beginning sentence we made was this: nothing has changed over 150 years. People still think it's important to do high-tech medicine and forget about geriatrics. We're a very ageist society in the developed world and in the developing world. It doesn't matter. We don't care about older people. And you say, well, that's not true. We love older people in the United States. Sure, if you're successful, Ronald Reagan, when he was president, we loved him. We didn't love him quite as much when he had Alzheimer's disease. They put him in his house. He had his private doctor and stuff. He was rich enough to do this. We don't always love people as they get older when they fail, and we need to be aware of that. And if you don't believe the ageism, the United States government, Congress last year, decided that all the money for geriatric education should be taken out of the budget because they didn't have enough money. That didn't mean that they wouldn't fund the Bridge to Nowhere in Alaska. They changed its name. They still funded it. But they stopped geriatric education. This is the year when we're becoming, baby boomers are starting to get over the age of 60. Does this make any sense? Of course it doesn't. It has to tell you we have a problem as how we look at older people, and we have a long way to go, and we need to be more aware of this. The good news as a geriatrician, I'll tell you, is this survey, which was in the Archives of Internal Medicine, points out that the most satisfied physicians are geriatricians. So for all of you who are thinking of career choices, you want to be happy, become a geriatrician. You want to be unhappy, become a gynecologist. Very simple. Go into internal medicine, not very happy. I have to tell you, pediatricians are almost as happy, particularly the neonatologists. You know, they like playing with those little babies when they're really small, and that's okay. Family practice, not very good. Cardiologist, not good. And you know, you can go read this up if you like, but really, this is good. So the good news is, those of you who want to be happy, we want you in geriatrics. We have a great program at St. Louis University. Call me anytime. Always happy to recruit people into geriatrics. Okay. So let's now try and look and see how we get people like him. Genes. You know, he chose the right mother and father before birth. Queen Elizabeth's mother did very well. This guy here, exercise. So genes and exercise are key. One of the things we have to realize is there are two different things that happen. There's a time we die, but before we die, we go into an inactive life expectancy, a time when, in fact, we have some level of disability. Look here, multiple studies, Boston, Iowa, New Haven, they all show the same thing. Now remember, I told you men always live less long than women. But look here, women spend much more of their life in disability than men. So, us guys die off early, but we die off before we become disabled. Women have to live in misery longer. Again, my wife, who knows a lot more about things than I do, said to me, yeah, it's you guys again. You know, you did this to me, and that's where it is. Simple, straightforward. So let's look at some of the physiological changes of aging. And when I talk about physiology and aging, the way I like to do this is basically tell you about the story of Tithonus and Aurora. Aurora was the goddess of dawn. As a goddess, she was entitled to have a morning and an evening lover. Now it turned out that Tithonus, who was her morning lover, was so good at what he did. Now you never find out what he did for her. So you have about 35 minutes to fantasize and work out what he did for her, and you will have the best lecture you've ever had. You know, I know how to get good marks on a lecture, so start fantasizing now, okay? Number one. But she felt she couldn't afford to lose him. So she went to her father, the god of gods, Zeus, and she said, Daddy dearest, please, I've got to keep this guy alive forever. Zeus is a doting father. He puts his hand in his pocket, pulls out a thunderbolt, throws it down, and Tithonus has immortality. The problem was she forgot to ask for eternal youth. So as the story goes, somewhere about 50, libido started to go down. By 70, potency was a clear problem. By 80, he walked with a shuffle and a stoop around her castle. And by the time he reached 100, he developed mild cognitive impairment, and he went around her castle muttering incessantly. At this stage, Aurora didn't love him anymore, and she just wanted to kill him. But she couldn't. He was immortal. So she heard him going mumbling around the castle one day, and she said, oh, I've got a great idea. And she changed him into a cicada. And whenever you hear the chirping of the cicadas, that's just a group of old men muttering incessantly. So what is the physiological changes of aging, or if you prefer, Tithonusism? And that is, first of all, vision goes down with aging. I wear glasses to read. I can't really read without them. Now, let me look around the audience at some of the students. You all wear contact lenses, but that young lady back there has got her glasses on. So she's myopic almost certainly, right? You've got myopia. Okay, so the good news for you is somewhere around about 46, you're going to be able to see perfectly for 2 years because you're beginning to become presbyopic. And so you go through this period where for 2 years you can see beautifully. Then after that, you can't see a thing. And in addition to that, you're going to get cataracts before everybody else in the audience because myopics get early cataracts. So you're in a lot of trouble, but there is potential for you. And that is, if you give up immediately, and what sort of student are you? Are you osteopathic? Okay, so you want to give up now. What you want to do is go out and start painting, because 60% of the great artists in the world were myopic. So you will be a great artist, and you can be rich by the time you get to 46. But otherwise, cataracts, and other than that, 2 years, pretty miserable. Our hearing goes down as we get older. We basically don't recognize we're thirsty. That's why you see old people coming from the nursing home come in extraordinarily dehydrated when they get sick, because they don't realize they need to drink. We lose our muscle mass and strength, and I'll talk a little bit about that towards the end. We have this age-related memory disturbance. All the students here can learn much quicker than I can. It drives me crazy that my students at St. Louis University can learn so quickly and they know so little. Don't waste your time now. Use it. You'll never be able to learn as quickly again in your life. We lose our sense of smell. We basically develop an anorexia of aging that sets us up so that when we get sick, we can become malnourished. A decline in VO2 max, which is an integration of how the lungs, how the heart, how the blood system and the muscles work, is the single best way of knowing your physiological as opposed to your chronological age. Both men and women lose their hormones as they get older, and our bones crumble. So this is the aging process. Rembrandt van Ryn's self-portraits. Here he is as a very anemic young man who very few self-respecting women would be seen out with, to an okay middle-aged man who most probably got a few dates, to an older man. And this is what happens. There are clear physiological changes of aging. Now these translate into function. This is the world records for the clean and jerk weightlifting. This is 100% at 35. And again, you see the men going down by 30%, women going down more than men, even though they start at a lower level. So again, part of the reason women develop more disability is they lose more muscle strength as they get older. Here we're showing you the world records for the 100 meter, 800 meter, 10K for men and women, exactly the same thing, the decline that occurs with aging. Of course, you've all got parents, and here are your parents. Have a look. I'm not going to spend too much time on this slide. It always worries me, okay? And I've got some skin tags there. Used to have some eye flaps, got rid of those. Fortunately, plastic surgery is making life a little easier, maybe. Okay, hemorrhoids, yeah, we all have them by my age. Okay, this is where your life is. And Maya Angelou, the poet laureate for the United States, actually wrote a wonderful poem when she reached 70. And in that poem, she pointed out that she loved being 70 The world, she thought, was a better place with one exception. She complained that her breasts reached down to her knees. You can be very successful as you age. An example here are the Delaney sisters, who wrote their first book when they reached 100 years of age, and the Delaney sister, who lived a little longer, published her second book when she was 105 about her life. So you can do very well. Another example of great aging successfully. Aging successfully, to me, is overcoming disabilities and problems, not having good genes. That's successful aging. If you had good genes, that's life. But often things go wrong. Now, in this audience, has any one of you ever made a quilt? Not a single one. It's so sad. Yeah, great. One. Oh, I feel so good. 1.5. Okay, we're going up. She helped her mother or grandmother or great-grandmother. We understand. Okay. When you make quilts, you have lots of interosseous muscle strength when you're making them. You have to have those muscles working well. Anna Maria Robertson, who became Grandma Moses, fundamentally was one of the greatest quilt makers in America. She was famous for her wonderful quilts. When she reached 80, she developed arthritis, and she could no longer make quilts well. Now, 80 and famous, you can stop at this stage and say, I'm just going to give up, I've done enough. But she thought, no, she had to keep on going. She had to do something. So she took up painting, what she considered was a very second-rate profession, which was painting miniatures. And you see here the last of her paintings at 103 years of age. She became one of the most famous artists in the United States. That is truly aging successfully. Now, you can age successfully by making use of your disease. And an example here is Monet. Monet, as you know, was the first of the modern Impressionists. Here's the bridge across Giverny, and I think all of you can see it. That's 1899. 24 years later, it had totally disappeared. What had happened to Monet? I've already sort of told you. He developed cataracts. He was myopic and he developed cataracts. And this is what the world looks like through cataracts. He refused to have his cataracts taken out because he said the world looks much more beautiful now. And 3 out of the first 4 modern Impressionists had cataracts. And that's all modern Impressionism is the world seen through cataracts. So if you like it, be grateful that you'll get cataracts. But realize that it may be a little hard to function if that's what the bridge looks like. And maybe you need to make sure you get them out. So let's look at a little bit of science now. And I'm not going to bore you too much, so I thought I'd talk a little bit about worms and flies, because they are fun things, and I love worms and flies. You know, particularly in the summer, the housefly is so much fun to have around. Drosophila and C. elegans. These animals, we now can manipulate their genome. And so in the housefly, there's a Methuselah gene, which will make it live much longer. And in the C. elegans, which lives like 7 days or 10 days if you're lucky, you can almost double their life by playing with the DAF2 genes. So there are clearly genes, and there are multiple genes within our bodies, that if you change a little bit, you can prolong your life. Is this going to happen in your lifespan? No. But for your children and great-grandchildren, you may well be at the stage where gene prolongation or gene manipulation is going to be something you have to deal with. So if you want to live forever, how do you do it? This is one of my favorite questions for cardiologists. You have lots of bad cholesterol, LDL cholesterol. Because LDL cholesterol comes in 2 forms. It comes in a small, dense LDL cholesterol, which is terrible for you. It's very atherogenic. It gets into the arteries and it kills you. Or it can come as this large, buffy coat, basically, floating, buoyant LDL. That keeps you alive forever. So measuring cholesterol is, in fact, a stupid thing to do. Notice I love this word stupid. My granddaughter kicks me now when I say it. So that's why I like it. It means she cares about me. You know, it works very nicely. But just recognize that if you want to become 100, you need lots of this large LDL. And I see patients all the time, this large buoyant LDL. The cardiologist is trying to get rid of it by giving them a statin. Makes no sense at all. Remember, if you can get to 85, it most probably means that your cholesterol is pretty good for you. Okay, no matter what the cardiologist tells you, it's pretty good. So we're learning that centenarians have a number of genes that may allow them to live much longer. We know that there's some things that are not good for us in excess. One of these is cytokines. And there's now a theory known as the cytokine-related aging process. Didn't get a single laugh, so I have to show you this slowly. The cytokine-related aging process. CRAP. I'm very proud of this. It's become very important in the literature, and nobody picked it up. They were like you, all dense, okay. And this means that when cytokines are excessively elevated, they play a role in producing aging and disease. Cytokines produce frailty, impaired function, and increased mortality. This is IL-1, IL-2, IL-6, TNF-alpha, all the pro-inflammatory cytokines, not the anti-inflammatory ones. And they have effects on immunomodulation, which are deleterious. They cause anorexia. They change the way you think. They cause sickness behavior. They cause your bone to waste away. And we now have a new drug that will block this, that Amgen has developed to try and stop that. May be good, most probably will kill you, but that's okay. Decreases albumin synthesis, produces loss of muscle, which we call sarcopenia, loss of nitrogen, anemia, atherosclerosis, and it causes albumin to disappear out of the blood vessels into the extravascular space. Not something, you don't want any of this stuff when it's at excess. Now what I have to point out to you is if you have cytokines and they're not at excess, they're good for you. Cytokines protect us from all sorts of things, viruses and cancers and stuff. So it's getting just the right amount that becomes very important. And in fact, this was pointed out first by Kirkwood and Westerdorp in England. What they did is they looked at people in the 19th century who were aristocrats. And in England, they have great data on how long they lived, when they were born, when they died, if you were an aristocrat. So they could look over their whole lifespan. And what they did is they looked how long people lived after 50, because they didn't want to look at deaths from childbirth, which were very common back then. Now remember, in those days, there were no antibiotics to treat infection. And what they came up with is the simple finding. If you have few children, you live forever. If you have a lot of children, you're going to die quickly. Why? So it didn't make any sense. And people looked in the 20th century and it wasn't true anymore. We had antibiotics. It wasn't true. It turns out that people who have few children have high pro-inflammatory cytokines. These are basically the cytokines that are protective of inflammation. But the problem is if you have very high levels, you can't fight off infection. So Westerdorp has shown, for instance, if you live in Africa, the kids who die from malaria come from families who have high pro-inflammatory cytokines. The kids who live through a malaria attack have high anti-inflammatory cytokines. And so you have many children. Why do you have many children? High anti-inflammatory cytokines are fundamentally protective for children, not protective against disease. These are protective against disease but cause you to abort. So it's important to recognize you don't want too high cytokines. In Berlin, in the hospitals now, you come into the hospital, the first thing they do is they measure your genotype, because they can tell from your genotype whether or not they need to aggressively treat your septicemia to lower the cytokine levels because they're going to be too high or not too high. Fascinating where we're going with pharmacogenomics. And this just shows you that performance goes down when we have high cytokines. So how do we maintain vitality as we get older? Relatively simple. In the 13th century, Roger Bacon wrote a best-selling textbook. It was about how to live forever. And he said if you had controlled diet, proper rest, exercise, moderation in lifestyle, and good hygiene, you would live forever. Boring. I mean, who cares? We all know this, and none of us want to do it. So to make a best-selling anti-aging textbook, whether you're writing it in the 21st century or before, you always have to have a gimmick. His gimmick was down here, and I'm not going to spend any time on it because about nearly 20 years ago when my daughter was 16, she walked past as I was trying to prepare one of these lectures with this slide. She took one look at it and she said, "Hey Dad, where do we find one of those these days?" As you can imagine, this caused a lot of consternation in the Morley household. I'm happy to tell you she now has 2 wonderful children, one of whom she adopted from China, and I'm learning Chinese so I can talk to the Chinese girl, and it's driving me crazy. But these things don't exist, okay? And they don't exist in modern books that we sell any more than they exist in old-fashioned books. George Valiant at Harvard did a wonderful study where he looked at Harvard graduates, and he also looked at inner-city people living in Boston and followed them from 50 out to their 70s and 80s. And he wanted to find out what allowed them to age successfully. And he pointed out that if you get some exercise, you don't smoke, importantly, you cope well, you manage crises well. Very important. It doesn't matter how many crises you have, as long as you go home, kick the cat, and it's done. You've got to get rid of it, okay? You can't abuse alcohol, but we know now that between 1 to 2 drinks a day is wonderful for doing well, so you need some alcohol. It's important to drink 2. Now, for the students, that doesn't mean Friday nights, 12, 15 beers, okay? 2. 1, 2. Okay, can you count? Make sure you don't go beyond the 2, okay? Enjoy a stable marriage or relationship, extraordinarily important. And then finally, if you're an inner city person, watch your weight. If you're a Harvard graduate, it doesn't matter how fat you are, you do fine. That's what he found. So to summarize this, some time ago we published How to Age Successfully. Prior to birth, choose long-lived parents. Have your mother get regular checkups during pregnancy. Have your mother not smoke or drink alcohol. Have your mother take her prenatal vitamins and folate. Unfortunately, none of you had the chance to tell your mother to do that, so you were dependent on other things. So things change as we get older, and here we're eating fish, we're making sure we're getting enough calcium and vitamin D, very important. But eventually you get to 80 plus. When you get to 80 plus, the single most important thing I tell my patients is keep doing what you are doing. Remember, most of your physicians will not reach your age. Important, okay. So when you are finished at medical school, or you're finished as a nursing student, or as a health education student, and you go out there, please remember that you're 26, 27, and maybe you don't have all the answers for 85-year-olds because you read it in a textbook, because we don't know why most 85-year-olds got there, and certainly it's most probably not related to a lot of stuff we tell people, so we need to be aware of that. The other thing we have to realize is many, many studies have shown that spirituality is key to longevity. Church attendance, which you could interpret as social support. So for those of you who are not religious, go to church anyhow. There's a lot of social support, okay? It's getting out and going there, and we know that getting out is really important. And spirituality, which is a great way to cope. You know, when you get to 90 and you know you're going to die one day, if you believe you're going somewhere nice, it's much easier to cope with your illness. Very important. Many of these studies have shown it. Now, the important thing to tell you is this does not work for televangelists. There are now good studies that show if you choose a televangelist, it's useless. So don't send your money to them, okay? And vitality is associated with activity. Older persons who get out of the house daily have better outcomes than those who stay inside. What this means is if you walk to the mailbox and back each day, you will do better than if you don't. So what don't you want to do when you get old? Richard Asher summarized this. You don't want to become immobile. Look at the patient lying long in bed. What a pathetic picture he makes. The blood clotting in his veins, the lime draining from his bones, the syllabilla stacking up in his colon, the flesh rotting from his seat, the urine leaking from his distended bladder, and the spirit evaporating from his soul. Teach us to live that we may dread unnecessary time in bed. Get people up that we may save patients from an early grave. During my internship, the treatment for congestive heart failure with cardiomyopathy was to put people to bed for 6 months. This worked remarkably well. They didn't usually die during the 6 months. They died about 1 day after we got them out of bed. It was not a very good treatment. Okay, so never trust the cardiologist, absolutely. They told me this would work, and it clearly didn't work. Okay, just think about this. You need to get patients out of bed. We have acute care for the elderly units, which the whole purpose is to get people out of bed now. We do this all the time. Please remember, you do never, ever tie an old person down. You most probably shouldn't tie young people down, but I understand that about 1% of this audience actually will enjoy being tied down. That's fine. I have no objection to your kinkiness. But please, don't tie my old patients down. I do a lot of lecturing to nurses, and the first thing I tell them is, please don't restrain people. All the nursing literature has shown it causes harm. But I offer always that if you want to tie someone down because it makes you happy, I'm available. I haven't found anyone who'll do it for me yet, and I have no idea whether it's fun or not, but gee, I've got to find out one day. So please recognize, don't do it. By the way, the beauty of telling nurses that is they never tie anyone down after this, because they know what everybody else is going to be thinking of them if they happen to do this. This is the exercise prescription. You have to remember that we have to do multiple kinds of exercise. It's not just endurance. Most of my patients tell me, I walk the dog, and their dog is about this big, and the dog walks very slowly, and it runs there. The patient takes half a step. They talk to Mrs. So-and-so. They walk over there. Their pulse rate goes down during the walk, not up. This is not endurance exercise, okay? So you've got to do endurance exercise. Get the pulse above 100. You need to do resistance exercise. Very good studies showing resistance exercise improves heart, mind, and a variety of other things. You need to do something for balance. When we get older, we have problems standing on one leg like this and shutting our eyes. I should have pulled one of you out so you could show off how badly you can get, okay? Because I practice this all the time. You can bring it back by fundamentally just doing what I did. Don't let your patients, and that's from 40 onwards, do this without holding on the first time. I've actually had medical students who fall when I'm doing this with them, okay? So you can all try this afterward. Tai Chi, the ancient Chinese exercise, is a good way to do this because you catch a chicken and you're not allowed to let it go. And that's exactly the same thing. You're taking your eyes out of it. It's very important. Yoga basically gives you your flexibility, and you need some flexibility. And then as we get older, we tend to bend forward like this, and you put your center of balance there, and you run, and you fall flat. You need to be aware that you need to do posture or back straightening exercises. Some of you may have had a mother like me, who my mother made me stick a book on my head and walk around telling me, otherwise when you get old, your shoulders will lean forward. Now, I'm not certain when you're 5, it's really a useful thing to do, but that's life. Positive effects of exercise. Increased cognition, decreased brain atrophy, decreased dysphoria or unhappiness, an increase in the VO2 max, and remember I told you that's the best physiological marker for how old you really are, decreased sarcopenia and frailty, increased bone mineral density. Here is an example of what you can do. Frances Vessels, who we bring in from Virginia every year for our medical students to show off, is 84 years old. She does modern dance, as you can see there, and she does things that many of you can't do, okay? Trust me, if you try this, you'll fall flat. Now, I wouldn't say this is too magnificent, except for the fact that that's an artificial shoulder, that one there is an artificial hip, and both knees are artificial. This is the example of true aging successfully. So how do we know when an old person is doing badly? We know if they're doing badly when they lose their basic activities of daily living. And what are these? These are very simple things. They are the things you do to get through the day, to get up and get going. In the morning, you've got to be able to transfer. Don't have to walk. You can transfer to a wheelchair, but you've got to be able to transfer. If you're like me, you then run like mad to the toilet, otherwise you leave a little puddle behind. And then we hope you wash your hands, so you bathe. Now, when I lived in California, maybe Arizona too, the next one was a tough one to remember because, you know, in LA, if you walk outside without your clothes on, you're just like all the other kooks there. You do this up in Missouri, they call the police. I mean, you've got to dress, okay. And then if you're really civilized, you sit down and eat. And when you're finished eating, you basically get your gastrocolic reflex. You're on the freeway, it kicks in, and you've got to go. But you realize you don't want to go in the car. So basically, when you get out of the car, you don't leave a little green turd behind. You maintain continence. These are the ingredients for living home alone. Many years ago, when I was at UCLA, we actually showed that if you're missing one of those when you come into hospital, 6 months, and I can show you the same data fundamentally for getting out of hospital, you have huge increases in mortality and nursing home placement. This does better than any other measure we know from having cancer. New York Heart Association stage 4. Last year, Dr. Thomas at St. Louis University showed exactly the same thing. The only thing he added to it was if your BMI was less than 21. So if you were skinny, that was even worse than lacking one of these. So what do we do in geriatrics? In geriatrics, we focus on improving function. So a good internist, a good family practitioner, tends to treat predominantly disease. As geriatricians, disease is nice, but it's not our focus. Our focus is improving function. And what gives you function problems? Behavioral problems, frailty syndromes, polypharmacy, and malnutrition. And when we get older, like when we're children, we have lots of social problems, so we need social workers. So fundamentally, we have to recognize that geriatrics is a team sport. We need lots of people to do good care for an older person. I tell my physicians all the time, you are the least important member of the team. Because if you get the rest of the team to work, you don't have to do anything. It's wonderful. I mean, I can sit with my feet up on the desk. If everybody else, my nurse practitioner does the work for me, the pharmacist checking the meds, somebody else is doing the social work, so on and so forth, the physical therapist doing the exercise, I have nothing left to do. This is my job, to make myself redundant. So, what about memory problems? Memory is a passion no less powerful or pervasive than love, said Elie Wiesel. We have lots of memory problems as we get older. This was first recognized by Celsus in the 1st century when he pointed out there were 2 types. The one was delirium, or acute problems, where you talk nonsense, and the other one was the continuous dementia, or what we today would think of as Alzheimer's and the other dementias. Please remember, delirium is a dangerous diagnosis. People who come into hospital with delirium die. People who come into hospital with delirium tend to spend much longer. They go to nursing homes. Now, anybody here who's never had a year in medical school, osteopathic school, recognizes this. This is delirium. He's going crazy. He's seeing things climbing up the wall. We can all do that. But this is the other delirium, lack of attention. I'm talking to you, so we're getting towards the end of this lecture, and I see a couple of you have wandered off into outer space, and yet I've even been getting you to laugh, and you still wandered off into outer space. You're delirious, okay. That's how old people present with delirium, and often we get a combination of them. But that lack of attention is missed all the time, and that's where we run into trouble. Another component of delirium is when somebody who's old suddenly starts falling. The first thing you've got to think of is delirium, because that's the major cause of new onset falls in older people. The causes of delirium are easily remembered by deliriums, and amongst these is urinary tract infection, and you never put a catheter in an old person. It causes infection, and infection leads to septicemia and eventually kills people. So you avoid catheters. Watch out for people who, as they get older, have epilepsy, because we don't make the diagnosis, particularly of partial complex seizures. And then finally, malnutrition destroys the way we give drugs to people, and we never do this properly. So we developed a delirium room, a 4-bed room, where we have a nurse in there all the time. We have the sign up that shows the causes of delirium, and basically the house staff do very well with this. And out of this, we've shown that we now have no greater morbidity or mortality in our delirious patients than in our other patients. The next thing we've got to do is look at the reversible causes of dementia, because these are the people who've now had this longer, and they may have drugs, they may be depressed, they may have metabolic problems, problems with their eyes and ears. Every medical students take wax out of the ears of the patients in the nursing home, and they improve their mini-mental status by 1.5 points. That's better than any medicine that you have to treat cognitive dysfunction. Normal pressure hydrocephalus, tumor or other space-occupying lesions, infection or anemia. Now, I know for those of you who are right at the beginning of your career, these are hard to remember. So I'm going to help you remember them by talking about our presidents. Who recognizes this gentleman? I know, you're history impaired. This is Mr. Coolidge. Mr. Coolidge's son died 6 months before the end of his presidency. He became inordinately depressed, withdrew to his room, not come out, and his wife ran the country for the last 6 months of his presidency. Sure, many of you recognize here John Kennedy. Now you remember Khrushchev was sending missiles to Cuba, and this guy sat there and said, "You send them, we'll fight you off." He wanted to start World War III. Would anybody start World War III if they were thinking clearly? No. We all know he had Addison's disease. His adrenals weren't working. He forgot to take his cortisone that morning, and that's what happened. He had a metabolic cause, and that's why we finished up Russia falling apart. Okay. Had nothing to do with anything else. I'm sure many of you remember Ronald Reagan. Now, what you may not know is he fell off his horse about 3 months before the end of his presidency. He developed bilateral subdurals and fundamentally was delirious till they had taken out about 3 months after his presidency. Another example of reversible dementia. Teddy Roosevelt had an anemia of 4.3 during World War II. It's the other one, right? Franklin. I wasn't born in this country, thank you. It's a Roosevelt, I knew that much, thanks a lot. And I'm getting old and my memory isn't as good. Okay, but he had an anemia that was nothing. Okay, it was 4.3, and that's what happened. And then finally, not finally, because I have one more, this gentleman. Now, this gentleman told us that he could cut taxes, go to war, and balance the budget. If somebody told you that as a patient, you'd say they were confabulating. That's called Korsakoff syndrome, and there's a history that he drank a little bit too much alcohol early in his life. But I have to balance this in case there are Republicans in the audience, and we know that this gentleman is going to finish up with one of those. Okay, so moving forward now, and I'm sorry about Franklin versus Teddy, they seem the same. Okay, thanks for telling me. Okay, so moving on, Alzheimer's disease, one of the major scourges. We don't have good treatments at the moment, but we are hoping that there will be in the near future. We know that if you keep your mind active, it delays the rate of cognitive impairment, and if you avoid isolation and recognize and treat depression early, it maintains vitality. You all need to look for depression hard in old people. It makes a huge difference. Okay, what is depression? I don't know, but what about this patient of mine? And look at the anonymity, I'm looking after it very carefully. This patient was the companion of an 82-year-old. The 82-year-old died. The patient became very ornery, scratched the children in the house, basically became incontinent, stopped eating, and became severely malnourished. The veterinarian was called in, took one look at the patient and said, I know the diagnosis, this patient's got senile dementia, and he decided he'd carry out what he thought was the appropriate therapy the next day, which was euthanasia. Fortunately, he went home that night and got a second opinion from his wife, who had no medical training but lots of common sense. So she came out the next day, she held the paw of the patient, talked gently to the patient, hand-fed the patient. And what you see here, 3 months later, after excellent psychotherapy for depression, is one big fat cat. Number one cause of problems in older people is depression. Number two cause of problems in older people is that weight loss leads to death. Over the age of 60, if you lose weight, it will kill you. That doesn't matter whether you are obese or not obese. There are many reasons for this, which I might have put in, and one of them is that if you lose weight over 60, you tend to lose bone density, you tend to be more likely to fall, and you run into trouble and have hip fractures. Weight loss is also associated with problems with institutionalization. When you lose weight, basically you release the toxins that are in the fat, and that's PCBs and DDEs. In addition to that, you make lots of small, dense LDL. If you've got unstable plaques, these things will kill you. There are many, many bad reasons to lose weight as you get old, which means you've got to get to the right weight before you get to 60. I'm not telling you should be fat. What I'm telling you is it's too late when you get to 60, and you should have got your weight down before you get there. Food is a key to survival, and the ability to expend energy depends on this. Okay, so how do we lose weight? Maimonides pointed out a long time ago, for wasting, which represents old age, that's sarcopenia or loss of muscle, wasting secondary to fever, cachexia, and wasting that's called dogalshi or starvation. There's a fourth cause, lack of drinking, dehydration. 4 major causes of weight loss. We don't look at those well. This Austrian came to the United States. According to Cheech, he and Cheech used to smoke a lot of funny stuff, But in addition, he used to sneak out of the gym and take some roids because the roids were good for his muscle. That's what he looked like then. He still has great muscle delineation, but he's a lot older. Look what has happened to him. He's become a governor, and his muscles look terrible. Okay, so fundamentally, this is the aging process of sarcopenia. We get fat infiltrations, we lose muscle as we get older. There are many causes of this, and I'm not going to spend time talking about them, but we are working on fixing these. I talked about the cytokine, but testosterone replacement, looking at mechanogrowth factor may be very important. You need to recognize that as we get older, medications that may be wonderful for you when you're 30 can be terrible for you as you get older. This is the Polypharmacy Conundrum. Remember that dirty old man, Van Gogh? Now, this is his physician, Dr. Gachet, always painted with a foxglove in his hand. Why does he have a foxglove in his hand? Because Dr. Gachet gave Van Gogh high doses of digitalis to treat his epilepsy. Digitalis is useless for treating epilepsy. It's a little bit like amiodarone, a drug that many of you won't know, but is used often to treat syncope and arrhythmias, and is pretty useless and kills you, but it's used throughout the world. Okay, it's a terrible drug, but people use it. There's a place for it, but a very small place. Okay, so he was on a drug that he shouldn't be on. What the hell, that was okay. But it turned out it was pretty good, because one of the things digoxin does for you is it gives you yellow vision or xanthopsia. Van Gogh painted everything in yellow and became a famous artist. So, you can become a famous artist if your physician abuses you. This is a study we did with one of our pharmacists a long time ago, Gordon Island, where we showed as we reduced the medicines at the VA from 13.1 to 8.2, we fundamentally reduced hospitalizations and deaths. Our deaths would have been significant if we had not used intention to treat, because every single death that occurred in our group we treated went back to their physician. And their physician said those geriatricians are stupid, put them back on the drug, and we could trace the death back to the physician putting them on that drug. Think about these things. Doesn't mean you should always do this. Why are drugs so bad for you when you get old? Well, when you're young, if you get old or you get sick, you're starting up here as far as you're thinking. And if, you know, when you have flu, you don't think well. I mean, you don't want to write an exam in the middle of a flu. You know, you don't want to write an exam when you stayed up all night taking amphetamines or something to stay up all night, or you were taking, you know, Benadryl or something. All of those give you worse outcomes. You don't want to do that. When you're old, we start much lower, and therefore we rapidly go down and get ourselves into trouble with drugs. We need to be aware of that. Pain. Pain is not nice. And you need to get rid of pain, because pain causes problems as you get older. Also, it just doesn't make you happy. Pain has been called the fifth vital sign. The third vital sign is respiratory rate. The respiratory rate is always recorded as 20. Actual normal respiratory rate is about 12 to 14. But everybody records it as 20. In 1954 in JAMA, they pointed out that about $1 billion a year was wasted by recording nonsense respiratory rates in America. So it's most probably 2 or 3 billion now. So please never record the respiratory rate, students, as 20. Okay. 21, 19, I know you're not measuring it, but, you know, so a vital sign is not important if you don't measure it properly. And the first thing is you've got to measure it. The second thing is when you see it, you've got to do something about it. And what do you do about pain? You don't give somebody a PRN medicine. It's okay if you're a student, you get occasional headache, take a Tylenol, that's okay. But if you've got chronic arthritis, you stop the pain coming on, you treat it around the clock. And it makes a huge difference to function. And if any of you are exercising and you're hurt when you exercise, if you take a Tylenol or an aspirin before you go exercise, you will be able to exercise better. Now, that doesn't mean every time you exercise you should take it. But some of you tear a muscle or something, that's the way you have to do it. It's no use taking it afterwards. It doesn't work. So what I've been trying to tell you is that there are some wonderful high technology things that we may finish up doing in geriatrics. And most of my research is on molecular biology, and I love molecular biology, and I love mice and stuff. And I really enjoy doing this stuff, okay? But it's not, at the moment, what's most important for my patients. It's the high touch stuff. And the important part of high touch is to realize that we all need a hug every day. We all need to be listened to. Okay, so wait, you're in a hurry. That's because a girl's next to you. You're going to get your chance, okay. But I'll find a guy for you. I've got you, okay. So he's mine, okay. So what I want you all to do now is turn around to the person nearest you, with the exception of that guy, and hug the person next to you. Come on, all give somebody a hug. It'll make you feel much better. Don't kill me. Okay. Did you get your hug? And I hope you did that in Arizona as well. Okay, so to finish up, this is the last slide and we're finishing. Okay. So this is my favorite patient, Emmy Squires. Don't look after her anonymity, because Emmy has been on every TV program, everywhere, has been in multiple newspapers and journals. And she's with our donkey here in our Eden Alternative. In our nursing home, we have had all sorts of animals. We had a llama who hissed at the patients and got thrown out. We had some goats who jumped over the fence and ate all the furniture. The administrator got rid of them. But Peanut Butter was the donkey, and I really liked Peanut Butter. But often I give talks like this, and then I go back late at night when I get back to St. Louis to go to the nursing home. I'd flown in, and the airport's right near the nursing home. I was working at 8 o'clock at night near the end of the month to finish seeing my patients and writing notes. And I hear the nurse saying, "Dr. Morley, come here quickly." I say, "Ooh, an emergency." I rush, good doctor that I am, to be helpful. And there is the nurse with a carrot in her hand saying, "Dr. Morley, come here quickly." I sort of slunk out of the nursing home as quickly as I could. Didn't want anyone to know I was there. Fortunately for me, the donkey kicked the chicken. The chicken, who lived for 9 years, was beloved by the residents, and the residents' council expelled the donkey from the nursing home. This meant that I never had to hear myself called an ass again. So I was grateful for that. Thank you all very much. Okay, we're supposed to take a couple of questions, and I want to go get the Cardinal score, unless somebody knows it already. Are they beating the Cubs? None of you know. Okay. Any questions? You can. Okay.
Those of you in Arizona, remember healthyaging@atsu.edu. We'll get your email here, and we'll pass the question on to Dr. Morley. Remember, healthyaging@atsu.edu. Okay. First question. Is there evidence that head injuries can accelerate the incidence of Alzheimer's disease?
Okay. There's evidence that head injuries may cause problems as far as memory is concerned. There was a very good study in the Lancet nearly 20-odd years ago that showed that people who had head injuries and then died 4 to 6 months later had huge amounts of amyloid plaques in their brain. So the answer is yes, head injuries can do that. Ronald Reagan may be one of the classical examples of someone whose head injury perhaps accelerated his Alzheimer's disease, because most people who are very bright, very educated, talk a lot, have much later onset Alzheimer's disease. So yes, there is evidence. Another one?
Another question. What are your views regarding intentional weight loss in a 65-year-old?
Now, we chose 65, I assume, to make it difficult. Okay. It's relatively easy. At 70, there is no reason to lose weight unless you weigh 400 pounds. That's about the only reason you could justify it. Maybe 5 or 10 pounds if you had diabetes, but very little, and you have to be very careful about that. 65, I actually don't tell my patients to lose weight. What I tell them to do is exercise. And I tell them to do a lot of resistance exercise and endurance exercise. That often leads to weight loss. And I think that that is the approach. And I don't believe that anybody I see, which is usually 70 and above, should ever lose weight. And all the data shows weight stability is the answer. You shouldn't put on weight. That's not as bad as losing weight. Losing weight is worse. And remember, in the recent JAMA article where they were actually looking to see what are the bad prognostic factors, they used a BMI of less than 22 as a bad prognostic factor. So you don't want to be skinny when you get old. You want to be Rubenesque-ish. Somewhere in between. That's where you want to go. Rubens painted all those big nudes, for those of you who don't know. Okay. Any more questions or thoughts? You can call it out, sir. You don't have to write it down.
At what age do we lose the ability to increase muscle mass?
At what age do we lose the ability to increase muscle mass? It's a very good question. The answer is almost certainly 30. Your testosterone levels start going down at 30, and at that level, there's actually biochemical changes and everything else. So all of the students have a few more years where they can optimally increase muscle mass. Now, that doesn't mean that at 80, if you've lost a lot of muscle mass, you can't put some on. But you'll never get to the same level as you would have got when you were 30. So there is no age where resistance exercise won't allow you to put some muscle on, but you can't get back to where you were. So it's better to do some than none, but don't expect to look like Arnold looked. And that was a great example. I mean, here's someone who still exercises, does the same things. Look at the difference in the muscle. And there's a huge amount of research going on trying to see if we can replace muscle without exercise. Testosterone is one of those things, but we don't know all the side effects and stuff. Amgen has developed a antibody to myostatin, which is an agent that inhibits muscle growth, and they are trying that out. Wyeth has a similar one. We have a product like that we've developed. So there are all sorts of products that people are looking for, and you're going to be flooded over the next 10, 15 years with these products. At the moment, other than testosterone, nothing builds muscle mass. Testosterone will build muscle mass and most probably strength. Growth hormone builds muscle mass, but no strength. So that's why you can't go to the anti-aging doctors who give you growth hormone. It'll give you lots of muscle that you have to carry around that you won't be strong enough to carry around. Okay, yeah.
We sometimes also in geriatrics have to take care of younger individuals who have BMIs of sometimes more than 35 or 40 and have like a frailty syndrome. Would you ever recommend them to be put on drugs like Orlistat to try and reduce their weight because they're not candidates for life?
Okay. What's younger?
Sorry?
What is younger?
55.
55, okay. In middle-aged people, you need most probably to lose weight. Orlistat is not necessarily the best way to do it. It works for some people. The drug most probably that is going to be most used is Rimabant, which is the anti-cannabinoid receptor. Many of the students may know that cannabis is a drug that messes with your mind and gives you the munchies. Okay, so there is now a drug that messes with your mind and takes away the munchies and makes you all the things that you're not when you're on cannabis. Think about this. Okay, that drug actually has specific effects on visceral obesity, the bad obesity around the stomach that it reduces. It's not a great weight loss drug. It may work. But the secret at any age for weight loss is exercise first, because if you fail to exercise, what tends to happen is you're going to become the fat frail. Because every time you diet, you lose 75% of your weight as fat, 25% as muscle. When you go ahead and you then do what most people do, you put it back on. You put back on 85% as fat and 15% as muscle. You can no longer carry your fat around with you because you don't have enough muscle. These are the fat frail who do terribly. I must point out to you that we and many other people have shown that fat people have more muscle and are stronger and have better function over the age of 60 than do average weight people. So you're better off being somewhat fat because you're exercising if you go out of the house. Now, if you're a fat person and you sit on the couch and you never go out of the house, that doesn't work. But if you get up and carry your fat around, that's called exercise as you get older. Okay.
I think we have some Arizona questions here. Okay, I'll read it. Hopefully, I have that presbyopia thing going on here. Okay.
You need my glasses?
Dr. Andrew Well offers the idea of morbidity compression. Illness and disability happen in a more condensed time frame before death. Is this a valid goal supported by literature?
Well, morbidity compression was first thought of by Dr. Fries, a rheumatologist in San Francisco. Dr. Weil has incorporated it into his concept, and that's fine. I mean, it's a nice thing. We would like to, what happens, as we showed you, is you get more disability as you get older. What you'd like to do is compress this into as late as possible. Is it a reasonable goal? Yes, it's a reasonable goal. Well, how do you get there? You get there by choosing good parents. Good start. Too late, okay. Then you make sure you do the right things throughout your life, starting as a child. So if you're a girl, you drink a lot of milk, and make sure you get adequate calcium so you build your bones, so you don't get osteopenia when you're later. So you go through life doing the right things. Balance your diet, never put on weight, do exercise when you're a kid, and keep on doing exercise throughout your life. These are the things that compress morbidity. And then find a sensible doctor who doesn't want to treat every single thing that's wrong with you and will basically use manipulation rather than a drug when the manipulation will work. And I feel very strongly about this. There's so many things that we can do with manipulation, talking to people, good health habits, rather than adding a drug. You know, if you smoke, treating your hypertension is sort of stupid. I mean, smoking's going to kill you. Stop the smoking, then I'll treat your hypertension. I tell my patients this. I don't treat hypertension if you smoke. Why should I do it? It's really minuscule. You've decided you want to kill yourself. Why should I now give you a drug that might, by mistake, kill you even earlier? Got to be careful about this. So compression of morbidity is where we want to go to, much more than increased longevity, but it's not an easy thing, and it requires a partnership, and particularly it requires the patient to do most of the work.
You haven't commented on vitamins or vitamin supplements. What's your opinion?
Okay. If you're underweight and losing weight, most probably you should be on vitamins. You need to be on vitamin D at 800 well, you may not. Every woman in this audience over the age of 60 needs to be. Most men, by the time they're 70, need to be on vitamin D and calcium, okay? And the vitamin D should be at least 800 international units, or it's not going to work. Where do you go beyond that? Elevated homocysteine. We've been trying to lower it, but in this country, because we fortify our bread with folate, in fact, most of the elevated homocysteine is due either to thyroid disease or to renal failure, and you can't lower it nearly as well as in Europe, where they show great effects by getting it down. So if we didn't have fortified bread with folate, or you don't eat bread, you want to look at the homocysteine. Beyond that, the rest is questionable. All the data says that vitamins in food work better. And I think this is one of the reasons why you do so well if you eat food rather than basically take a supplement. Supplements are never as good as eating good food. Willett, who did all the early studies on cholesterol lowering, could only show that lowering cholesterol epidemiologically made sense when he took out the single thing that most protected you from heart disease. Anyone in the audience know the single thing most protective from heart disease? Not smoking, okay. Water. Sorry? Water, no. It's the more you eat, the less heart disease you'll get. Not the less you eat. Now, we know obesity is associated with heart disease, so you've got to think through this a little bit. People who eat a lot often exercise a lot. So you may have been a two-point phenomenon, but there's also data that says that eating is good for you. The way you get your nutrients and your micronutrients, if you get it in food, you do slightly better. So I'm not a great proponent of just taking a vitamin for the sake of vitamins. I mean, we did a study looking at vitamin changes in older people in New Mexico. We started with 380 people. We finished up with 16 who had not taken vitamins over a 14-year period. So, you know, I realize I'm saying something that nobody's going to listen to me anyhow. Every single American takes vitamins. I mean, you know, but in fact, making sure your weight maintained with a good diet is most probably more important. Yeah?
I believe I heard that in France, they're attempting to reverse the effects of Alzheimer's by teaching patients how to play bridge.
Yeah.
Have you heard of that study?
Yes, that's actually been done by a friend of mine, Bruno Villas, in Toulouse. And Bruno is doing a number of things, but the first study was done in Chicago, where they had them do crossword puzzles and things like that. And there is data that says that you will slow down the deterioration. You won't reverse it, but slow down the rate of deterioration if you keep your mind active. Remember that better educated people, which really translates to people who in their 70s and 80s are most probably still reading, still using their mind for things, tend to have less Alzheimer's disease than less educated people. But it's not related as much, I think, to education as ongoing using your mind. So you should always use your body and your mind. You stop using it, you're going to lose it. It's as simple as that.
Is that study ongoing or have?
There are many studies. There are multiple studies. His is a huge study. It's ongoing. But there are many other studies going. A question from a student. You've got to be young enough to be a student. Good. Go for it. Yeah. The more time you spend sleeping, the less time you have to enjoy life. Okay. No, I mean, you need to get a reasonable amount of sleep. The data is all over the place because you get people like Winston Churchill who slept 2 hours a night. I sleep 2 hours a night. I'll balance it because he lived to 80. I'll almost probably die today or something on my drive back. But you need adequate sleep for you. You've got to remember that many people, particularly if they put on weight when they get older, get sleep apnea because they get fat around here and they have poor quality sleep. Poor quality sleep, not getting enough REM and slow wave sleep, is really most probably the thing that worries you most about how your aging is. Now, you know, there's wear out as well. So you sleep 2 hours a night and you do all sorts of bad things in the other 22 hours. You know, you may not get as old, but there's not as good a relationship that I'm aware of. I don't know if any of the geriatricians here know a better relationship. There's some in animals, and actually I was reviewing an article on the way up here while my wife drove me because I can't drive well, you know, basically that said that sleep is associated with, poor sleep fragmentation is associated with developing beta amyloid. We don't know enough, and there's too many exceptions both ways. So are you an oversleeper or an undersleeper? You're an undersleeper. That's good. So you're top of your class, right? You've got all that time to study. Now, I was an undersleeper. I mean, I've slept 2 to 3 hours most of my life, to be honest. And this did not translate to improving my grades one little bit. Just got to be aware of that. Do we have one more question?
One more question here. Comment on treating hypercholesterolemia in someone over the age of 65.
Comment on treating hypercholesterolemia over the age of 65. Okay. Again, 65 is difficult because the data is all over the place. So first of all, I will not treat hypercholesterolemia in an older person, and I'm going to define that as 70 because I feel very safe that the data is with me, unless I have measured a small dense LDL. And the small dense LDL has to be elevated. So I won't treat these people who just have an LDL. And I will not go in older people to the ridiculous levels that people would like me to do. I also look at the HDL. I have many patients who are 80 with cholesterols that are high. LDL is high, but the LDL is 80, 90, 100. That's protective. Doesn't matter. If you can't measure small dense LDL, you measure triglycerides because elevated triglycerides go into the VLDL, and that's how you make your small dense LDL. So you can do it that way. When would I use a statin? I would use a statin in any older person who has an acute myocardial infarction for 3 to 6 months because it most probably has anti-inflammatory, anti-cytokine effects that are useful. So I think that is a reasonable place to use it in many of these patients. I'm not going to take somebody off who got to 70 because they were on a drug. I'm going to think very hard before I do that. And then I'm going to look at using PPAR alphas if their triglycerides are very high. PPAR alphas are that old-fashioned drug, gemfibrozole, or the new fibrates. So there are multiple different things. We have to think this through. But the PROSPER study, which is always quoted, this is a study in people 70 to 85, as being the reason for treating older people, showed the following. It showed you decrease heart disease by 25%. That's nice. But unfortunately, the people lived exactly the same amount of time. They had no difference in function and no difference in thought process. So all it did is it shifted disease from heart disease to something else. So you need to know who to treat. And I think we are starting to learn with the evolution of the small dense LDL, who we should be treating and looking at triglycerides, HDL in the same package, we also need to think how to treat people appropriately and when to treat them. I treat very few people in their 75 and beyond because I can't find very good reasons to treat them. They don't get there. You don't get to 75 if you've got cholesterol that's bad for you, because then you die off early. I mean, this is when the men disappear from the population. You know, us guys somewhere between 50 and 70, we have the big one, and that's it. And that's, you know, if you get to 80, gee, you know, this is okay. So I don't treat as many people as my cardiology colleagues would like me to do. Am I right or wrong? I don't know. Okay, are we about finished? Thank you all very much. That was fun.